Welcome back to the Lymphoma and Related Diseases Registry. Today I'm very honored to have Dr. Tamara McConney next to me. Hi Tamara.
Hi, Eliza.
Could you tell us about yourself?
I'm a haematologist at Eastern Health, the lymphoma lead at Box Hill Hospital. I'm the principal investigator on a number of clinical trials and the sub-investigator on others. My primary area of interest is in lymphoma. Started in clinical research as a registrar back in 2021, being a sub-investigator on a number of studies, and then have taken on the role of the lymphoma lead as of 2024 after completing my fellowship and also working in the lymphoma space.
Okay, cool. And can you tell us about the challenges you face for patient recruitment for the registry?
The primary challenge that we've had is that there is not a assigned study coordinator to the lymphoma registry. So we've had issues with data entry and balancing of responsibilities. As the fellow, I was responsible for uploading patient data, and understandably, as a busy clinician, it comes second to patient care. We have used medical students who've helped us with data entry. However, it takes some time to train and upskill the students to be able to correctly interpret the patient information and upload accurate data.
Although being a very busy clinician, you have been involved in a few sub-studies of the LADA. Could you tell us about your research experience?
Certainly, we had contributed data to the use of DHAC in relapsed refractory diffuse large B-cell lymphoma sub-study that is being presented as a poster at Blood. We also contributed to the obesity and polatuzumab study, and I found it a really collaborative experience. It's been great having yourself helping with coordinate data entry and timing and patient selection, so it was a really positive experience.
Yeah, the obesity and polatuzumab studies were done during your fellowship, right?
Yeah, certainly. I think just being involved with identifying the patients, reviewing all that case data, it certainly opened my eyes. Yeah, I found it really interesting.
And you learned how our data collection works, our data management on the database as well.
Yes.
Have you got any advice for other early career researchers or medical students out there?
So I would really encourage any students to get involved. I think it's a really great introduction to clinical research and data entry. I think this registry is such a fantastic resource for us all. In Australia, we have a lot of patient numbers, although we are geographically dispersed. It's really important for us to capture our real-world data to allow us to publish that and use that information, particularly within the rarer subtypes of lymphoma, where there's very little randomized evidence and we rely so heavily on our real-world data.
Of course. Thank you so much for your insights and your time today, Tamara.
Thank you, Eliza.
Thank you.
Thank you.
We'll see you again next time. Bye-bye.